Good evening, everyone. I'm Joe Gazen. We hope you are safe and healthy wherever you are tonight.
And I'm Leslie Adamy. We begin tonight with the latest on the FDA panel's official recommendation for a second coronavirus vaccine and an update from Texas Governor Greg Abbott on the ongoing distribution of the Pfizer vaccine. The FDA panel officially recommends the Moderna vaccine, paving the way for FDA authorization, meaning that shipments of the vaccines could start heading out to medical facilities in less than 24 hours.
And Governor Greg Abbott says with an expected increase in the number of available doses in the weeks ahead, as many as 1 million Texans could be vaccinated by the end of the month. Our Mike Gillespie has more on what the governor said today and how it affects you in tonight's top story.
With a familiar brown UPS truck as his backdrop, Governor Greg Abbott praised the delivery company for getting the Texas allotment of the COVID-19 vaccine where it needs to be. But then the governor got down to numbers. Big numbers.
Before today, we had already delivered about 95,000 doses of the COVID-19 vaccine. Today, an additional 129,000 doses will be delivered across the state of Texas.
That's over 224,000 doses being sent across the state, and there should be even more of the vaccine available next week when both Pfizer and Moderna will be in play. The governor also indicated that at least by the end of December, deliveries would be expanded beyond hospitals to include, among others, clinics, pharmacies, and urgent care facilities. But then Governor Abbott took a moment to move away from vaccines and urged the continuing use as a tool in the fight against the virus, something we already have: antibody therapeutic drugs. It is the same treatment used for President Trump when he was infected with the coronavirus back in October.
They are sitting on shelves in the hospitals and other locations around the state, and that's not being used for the reason which is it is intended. These are life-saving antibody therapeutic drugs that can be put into people who already have COVID-19 and help them recover and help keep them out of hospitals.
The drugs are available and intended for those who have been diagnosed with the virus and who are at the highest risk of having it progress because of obesity, chronic kidney disease, or diabetes. It reduces the chance of those patients ending up in the hospital. Also, when asked today about the possibility of once again placing restrictions on bars and restaurants in an effort to reduce the number of COVID deaths across the state, the governor had this to say.
People's lives have been crushed, and their pocketbooks and their ability to pay the rent and put food on the table has been harmed because of the shutdowns. And so, no, we will not have any more shutdowns in Texas.
Mike Gillespie, 3 News.